Hey guys, it's Astra from the Barton County Chamber, and I'm joined today with Joel Dermott, and he's the director of the Barton County Health Department here in Lamar, Missouri. So we have some big news that came through the state that the COVID-19 vaccine is in the state of Missouri now.
That's correct. Yeah, we've received a little over 51,000 doses for the state. Those are earmarked for the frontline COVID workers in our hospitals and care units. So those are already designated there, and that is happening as we speak. That's being distributed out, and those people are being vaccinated and will continue to be this week. That's the first round. The second round of vaccinations that it's coming in should be in next week of Christmas, and those are earmarked for residents of long-term care facilities. And those facilities are already contracted with the federal government. Put a program out where Walgreens and CVS pharmacies have volunteered to administer those vaccines for those nursing homes. So what's going to happen is those will be distributed to them, and then they will go to the nursing homes and actually vaccinate the residents of those facilities. Then after that, what we will begin to see in more of a widespread distribution will be for those people who are 65 years and older, those people who are immunocompromised, the rest of our first responders and healthcare workers, staff of our facilities. Those types of people will be in the third and fourth rounds of these vaccines. What we hope to see is that what they're telling us anyway, is that by the end of February, if you want a vaccine, you will be able to get it regardless of your age or demographic, whatever the case may be.
Okay. All right. So that's big news. So
it is.
Yeah. And so whenever we get more information about that, we can always update either this platform or another one. Sure. So very good. Absolutely. All right. So, and also there are some new guidelines on quarantining and close contacts. Can you share some of that new information with us, please?
Absolutely. We had the CDC release some new guidelines for us about a week or so ago, and they have made it probably a little easier on folks. What the guidelines are now on close contacts, it had been a 14-day quarantine if you were a close contact of a case positive. Now we have a couple of other options. The 14-day is still there if we feel that it's necessary, but we have a new guideline which says that if you have been symptom-free for 10 days, that at the end of that 10-day period, that you can come out of quarantine, and you still need to monitor your symptoms for the full 14 days. But if you've been symptom-free for 10 days straight after your last contact with a case positive, you can be released from quarantine. The other option is a 7-day option, and it's a little different in that it has the same 7 days without symptoms after your last contact, but you also have to combine that with a negative COVID test. That's a little tougher to do just because most of your providers are not going to test unless you're symptomatic. So it's going to be a little tougher to get a negative test if you have no symptoms at all. And it's really designed more for some of our care facilities where you have staff and they're doing their own testing internally in-house, so they can run those tests on a periodic basis, and so they can get staff back to work quicker and get them going again. But it's pretty big news. People have generally been very receptive and excited to have other options.
Okay, so we've got a new quarantine close contacts, the 10-day and 7-day. All right, and then also too, how are our numbers? I know that sometimes it's a bit confusing because we will look at our numbers on the county, which you guys report on your social media platform. And then also we'll look at the state of Missouri's reporting, and sometimes they differ. So can you touch on that a little?
Yeah, and that's a pretty good question. Common question we get quite a bit. And it's the system itself is a little complicated at times, and the numbers that the states release on our statewide dashboard, which you can access that at any time, and it is a good thing to do. The numbers there though will not always line up with ours, and you say, well, what's going on? Are we hiding numbers? Are we playing games? And we really are not. a lot of the state numbers that they get are pretty raw numbers when they get released. And then when we get them into the county, what we try to do is we try to eliminate those people that are on there more than once, where you have, they may have tested at different times in a recent time span, so they're on there twice. We have a lot of times where the people inputting the information, the providers, they're not sure what county, and so we get a lot of other counties' information, and so we have to go in and remove that and redirect those. Those don't always get reflected and updated at the state level. They dump the numbers into their dashboard, and then we have to kind of go back in behind that and clean it up. Another thing that we just run into from time to time is just there are some providers who get behind, and so they may make dumps later or from previous months, back maybe 2-3 months ago. We may get reports from there, and so it's kind of hard to keep up with that and to know what our numbers actually are. So we try to look at that. It's very tough to do. So what we look at is what the numbers that we post or what we have as far as case reports to us from the state, where we've taken out all these other things. And then we also look at our active cases are important to us. We run right now, the last 2 or 3 weeks, we've been running anywhere from 25 to 35 active cases in the county. And it is what it is. And we try very hard to get that information out there as much as we can, but that varies a lot. The other thing that people may get confused about is our death count. If we have fatalities and say, well, I heard so-and-so died of COVID, but your numbers haven't changed. The state has directed us that we cannot post any death notice until we receive an official notice through the state of Missouri. They have a review board that goes through all of them. So when they release that information to us, then we can post it. It usually takes a little bit of time to get that done, but it does come through. And so some of them are a little bit delayed. But again, we just can't unilaterally do that. We have to wait for the state to give us the final report, and then we can post.
Right. So there's a whole process behind the scenes that sometimes we as the public don't see.
Absolutely. And my biggest advice is don't get caught up too much in the numbers. Understand that the virus is everywhere you go. There is the chances of you coming in contact with somebody who either has the virus, has had the virus, or been in contact with somebody who has had the virus is pretty strong. So be very aware of where you're at all times, and understand that the virus is everywhere. There's not really a hot spot in the county or in this region. It really is everywhere you go.
Okay. All right. So some general advice: wash your hands often, wear masks when you can, social distance when you can. Is that basically the biggest?
Absolutely. Those are huge. And the other thing that I have to emphasize is if you don't feel well, stay home. Even if you think it's just my allergies acting up, or it's just a sinus infection, or it's just a cold, please stay home. We see more spread of it by people going to work sick, by people going to a social gathering, people going to their family gatherings when they're not feeling too well. And that is where the spread comes. So please, of all the things that you can do, wearing the mask is great, social distancing, good hand hygiene, all that is great. But one of the biggest things you can do to help your neighbor is to stay home when you're sick. Okay.
Very good, Joel. All right. So I think we've pretty much covered it. We went through our questions. We went through our bullet points. Now, if anyone has any questions, what do they need to do? Do they need to just call the health department?
Sure. Just call us. That's what we're here for. Our phones are ringing all the time, and that's what we want. We'll get, if we can't get to you right then, leave a message for us. We do return our calls. We do get back to you. It's very, very important. That's our main emphasis has been on dealing with people and being there to support our citizens, being there to support our businesses, our schools, our organizations. That's what my main emphasis is. That's what we spend our time doing, is talking to people and helping them as much as we can.
Very good. Well, thanks so much for all the work that you guys have been doing and all of your help and info. And I guess until next time, we're going to sign off. Thank you, guys.
See you later. Bye, Astra.